All. This is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So this morning we had Dr. Tina Pierce who talked about the long haul management and possibly mast cell activation syndrome and the management for that. Last time when we talked about the long haul syndrome and last time when I spoke with her, there were a lot of questions about the low histamine diet. She mentioned that today as well. And of course, there were lots of comments and questions that what is a low histamine diet. So I thought that she's great. So I thought she was tickling. So I thought I would share low histamine diet. At the end of the discussion, when we went offline, then she said, Dr. Mubin, you have done so much good work that I want to give you a kiss. And so she sent me a flying kiss, which was awesome. So she is very, very talented, and she is doing a lot of good work, especially in the UK where ivermectin-like drugs are, or tablets or medicines are not allowed. She is actually trying to get those as well. So good work on her part. Let's start our discussion. So this is drbeen.com. The links that are present, the things that I would talk about, they are in the description as well. Credit goes to Everywhere Bean from San Jose on Discord. So let me just show. So this is here. Sorry, not everywhere. Been a while, San Jose. So Been a while Bean on Discord server put some of these possibilities here. And what I did was I just collected some more data. So this is the Eat Beautiful site. And over here, if you look for low histamine diet, you would come across this article by, I think this is the author. There is one more. This is histamine.org.uk. And they also have a beautiful, the whole site is about histamine. But this article here, the treatment is beautiful. This is for the histamine intolerance or for mast cell activation syndrome-like situations. So I think it is worth a read. With that, I have histidine. Histamine is made from histidine. So histidine is an amino acid. What is that? That is over here. Then there is a very important enzyme called diamine oxidase, and that is the enzyme that helps break down histamine. So this enzyme can be overwhelmed, it can become deficient, or it can be present less due to genetic mutations, which can lead to increased levels of histamine in our body, resulting in MCAS-like situations. So we'll talk about this as well. And then just to tickle our brains, of course, this, as Texas was saying here, Cool Bean, Texas, that the FDA has this fight for a long time. So FDA sent out a letter to some companies that, hey, the NAC, N-acetylcysteine, that you are making and labeling as a product to cure hangover is not proven to cure hangover, so you cannot have it. And this particular fight, as Texas had put it, this fight had been going on for a long time. So if you see here, 1963, FDA last year asserted in warning letters that NSE couldn't be lawfully marketed in dietary supplements because it was first studied as a drug in 1963. So because it is a drug, they want to protect the consumers. Here they are. I really want to see, to me, FDA seem more and more like aliens. So we keep talking about UFOs and others. It seems like some other planets folks landed here in UFOs and now they're running FDA. So here they say as well that here we are trying to protect consumers. So I thought this was an interesting one as well. My wife today, she went to Sprouts. So she cannot be without NSE. Whenever she quits NSE, she has inflammations or pains. So she takes NSE regularly. So she went to Sprouts and she was able to find them. So with this, let's start our discussion. I want to start with a couple of drawings here. So the first thing, what are the diets? The takeaway for today, it is going to be practical. I hope that you can start it from tomorrow, or at least start thinking about it. So one of the food products that we cannot take is eggplant. So that's why I just made the eggplant here, which is crying. So let's see. How is histamine made? So our cells are actually comfortable making their own histamine. They do not need external histamine to be provided. Cells can take histidine, which is an amino acid, and that amino acid is present in our food product as well. And they can convert histidine to histamine and then use that. So here is a histidine. Histidine is an alpha amino acid. And here is the structure of this amino acid. Not very important for us to pay too much attention to it. But generally for the medicos over here, or medical or nursing students over here, this is the formula. In this formula, we have an amino group. We have a carboxylic acid. Although I wrote it as COOH, this could be COO negative as well. And then imidazole side chain. So this is the side chain, which is imidazole. So this is the basic structure of histidine. And what happens is there is levohistidine decarboxylase. Decarboxylase means removes the carbon, correct? Or carboxyl group, not carbon. So if you see here, this carboxyl group, which is here, COOH, is actually not present here. And so this molecule is now histamine. This is the formula for the histamine. It doesn't have the carboxyl group, but it has the remaining structure. Then this histamine is, of course, used in our body. It is used in GIT. The most amount of histamine usage and breakdown is in the GIT. So it is used in GIT. It is used by our immune system, especially the mast cell-like systems. Then it is also used as a neurotransmitter by our nervous system as well. This is why whenever we have an imbalance of histamine, all of the body systems start becoming upset, because GIT becomes involved, nervous system becomes involved. And when immune system becomes involved and starts producing inflammatory cytokines, that would in turn cause involvement of the whole body cells, because inflammatory cytokines will go everywhere and trigger the other immune system. And if it is a mast cell degranulation, then all bets are off. We'll start having allergies and the issues with allergies. So you can imagine that the whole body can be involved. Now, histamine, once produced, is broken down in our cells, and an important enzyme is monoamine oxidase or diamine oxidase. Both of those enzymes are important. So here is the diamine oxidase, here is the monoamine oxidase. What they do is they try to convert histamine into the products that can be then removed. Now this diamine oxidase is very important, because think about it. If somehow we block diamine oxidase, if we block it from breaking down histamine, what will be the result of that? Histamine will increase. On the other hand, if we increase diamine oxidase enzyme, then the histamine levels will decrease, and so on. So I have a tiny diagram over here. This is a triad that I made. So this is this diagram is my invention. So what happens here is, how can we have more histamine in our body? We can make more histamine, so create more. That is, provide raw material for histamine more, and make diamine, the enzymes that make histamine, kick them up. Or eat more histamine, make already made histamine more. So today's discussion is that how do we reduce that? So that is one way to pile up histamine and have histamine issues. Other way is that take diamine oxidase, that is the enzyme that breaks down the preformed or the formed histamine. You take that enzyme and overwhelm it. How do you overwhelm an enzyme? Give it too many things to do. Pile up histamine next to it, and it cannot break all of that down. And it is overwhelmed. Now there will be extra piles of histamine sitting on a side because the enzyme is already too busy. That is one way. Or make the enzyme blocked. There can be drugs that we take, which in turn will block this enzyme unknowingly, unwantingly, but still the result will be that the enzyme would function less and histamine will increase. Or go to some naughty cells like mast cells or other immune system cells, which will just release too much histamine. So either release too much histamine, or eat too much histamine, or break down too little histamine. All of them would end up in more histamine in our body. So this is the basic triad of the problem. Now let's see how we can manage this. And so this is Dr. Mubin Sayed and Cool Bean. So this is once again you and me. The reason I did this on PowerPoint, that I did not have enough time to draw all of this. So I took a more efficient route, although not my favorite route, and that is of presenting it via text. So my apologies for this, but once again, this topic is really important. We'll continue to build on top of it and we'll draw as well. So give me some slack here. So histamine, we just talked about it. Histamine is a biogenic amine, plays a role in immune system's function. So we know this, GIT's function and nervous system's function. There are two good sites I have shown here. These are the ones that I showed in the beginning as well. So Beautiful, Eat Beautiful, and the Histamine Intolerance.org.uk. They both have great wealth of information. Now, histamine intolerance. So I'm not calling it mast cell activation syndrome, but the result of that. So histamine intolerance could be because somebody cannot tolerate the normal levels of histamine, or somebody has great amounts of histamine and they cannot tolerate it anymore. And that greater amount of histamine could be because of mast cell activation, or because they're taking more histamine, or because the diamine oxidase enzyme has become depleted or blocked or overwhelmed. Whatever is the reason, body could become histamine intolerant. Not everyone is histamine intolerant, but some people can become that. So what causes intolerance? So let's say there are 10 people standing and 3 of them are intolerant. Why are they intolerant? There is possibility that their GIT system got injured, for example, by infection or by ulcerations or by Crohn's disease or irritable bowel syndrome. Something caused insult to their GIT system, and then GIT system became upset about histamine. Then gastroenteral reflexes or gastroesophageal reflex, or the ulcers. Chronic stress is very, very important. Chronic stress is really important. Some people actually have hives because of the stress. Gut microbiome imbalance. That can be incorrect food intake, that can be overuse of the antibiotics and so on. That can be because of the infections as well that can go and replace the biome. Liver disease, genetic mutations in some people can just predispose them towards histamine intolerance and more. Then there are drugs that can also cause histamine intolerance. For example, antibiotics, some antibiotics can do it. Antipsychotic, antidepressants can do it. Theophylline, for example, can do it. Cardiac drugs can do it. Diuretics, pain meds, muscle relaxants, alcohol, malaria drugs, TB drugs, and more. So there can be drugs that can cause histamine accumulation. Guess how would they do it? Most of them would do it by suppressing the effect of diamine oxidase. Now, generally, how is the histamine intolerance look like? Again, this morning's talk was much more elaborate. I am actually trying to reach the point of saying, here are the foods. So this is just context that I'm discussing here. So headaches, nasal congestion, sinusitis. You must have seen people who have allergies and their nose is, runny nose, or their eyes are watery, or they have burning eyes and so on. So headaches, nasal congestion, sinusitis, fatigue, myalgia, irregular menstrual cycles, hives, GIT issues, nausea, vomiting, diarrhea, constipation. It could actually be alternating as well, that sometimes diarrhea and sometimes constipation. Then abdominal cramping, bloating, gas, swelling of various tissues, blood pressure issues, arrhythmias, confusion, dizziness, anxiety, temperature regulation issues. Because the temperature regulation issues are for multiple reasons, but one of the reasons is the inflammatory systems activity, which then would cause to reset temperature systems and would mess with the temperature. Now, the role of diamine oxidase, that enzyme that is responsible for breaking down histamine. So it helps break down histamine. Highest level of this enzyme are in GIT. So GIT is a primary area where histamine is destroyed or broken down. Of course, a lot of histamine is made there as well. So how can we have the deficiency of this enzyme or relative depletion of this enzyme? It can be blocked by drugs, as we saw some drugs before. It can be overwhelmed by the foods that have too much histamine in them, and we do not have enough enzyme to take care of all of that histamine. So enzyme is too busy, but there still is more histamine. It can be relatively reduced by histamine liberating things. For example, let's say somebody takes peanut butter or peanuts and they're allergic to it. The result will be mast cell would produce a lot of histamine or liberate a lot of histamine. And now the normal amounts of diamine oxidase enzyme cannot take care of all of that histamine. So the person is then going to have the allergic response. Then there are foods, for example, alcohol, black tea, meta tea, green tea, coffee, energy drinks. They block this enzyme or they reduce the function of this enzyme, which will mean then the histamine levels will increase. So here is the meat of the discussion today. What foods to avoid? And once again, the links that I've shared, they have a much more elaborate set of foods to avoid and foods to take. But generally, what is it we are looking at? So look, fermented foods. For example, aged cheese or yogurt or sour cream, buttermilk, kefir, fermented meats, cured meats, sausages, salami, fermented ham, beef, fermented soy, grain, sourdough, and so on. So fermented products have a lot of histamine in them. Chocolates, coffee, tea, fermented vegetables, for example, pickles, wine, beer, alcohol, champagne, tomatoes, tomato ketchup, of course, which is my favorite, eggplants, spinach, avocado. These are the foods I'm talking about which have more histamine. So we need to reduce them. Vinegar, salted or canned fish, fresh meats are actually okay, but canned or salted or stored products usually develop histamine in them. Then there can be histamine liberating foods as well. So now this is the interesting thing. There is a lot of debate back and forth that are there actually foods that can cause liberation of histamine, and many people say no, and then some say yes. I would kind of sit between these and say, look, we have peanuts, for example, that can cause allergies. So this is not really a histamine liberating food, but this is an example of something that would cause release of histamine. And there are many other allergens as well that can cause release of histamine. So there are things that can cause histamine release. And believe me, not just the foods, the temperature change can cause release of histamine. I have given this example many times. The mast cell can become so upset, you're taking shower and just the water dropping on your body can cause mast cell to go mad and they can start releasing histamine. So they can be upset with very minor changes. And people who have these issues, they know when their mast cell would start releasing histamine. So there are possibilities of mechanical, chemical, or food-related release of histamine. Now, when you start reducing the histamine containing or liberating foods, what are the goods and bads in that? Look, the low histamine food can lead to malnutrition. You saw that if you see here, the foods, fermented things, cheese, yogurt, sour cream, meats, some vegetables, coffees, teas. So these are a lot of things that are usually in our daily routine. So when you start taking or stopping them, please realize that this could cause malnutrition. That means you got to take supplements of various vitamins. Plus, you have to only do it for a short period of time, most of the time just to diagnose that do you actually have a problem with histamine? Are you taking some food that is causing it? So you diagnose that within 3-4 weeks. And once you find out that, yeah, there is a problem, then you decide what to leave and what not to leave, instead of just leaving it these foods at a low level for a long time. So don't do that. Low histamine foods can help you diagnose, so that we talked about. Only take this diet for 4 to 6 weeks. Make a record of what diets you stopped. See where do you start getting some response. And then as you start resuming, keep an eye on those drugs which, when you stopped, had reduced your symptoms, and then see if starting them again resume your symptoms as well. In the meantime, when you are taking low histamine diets, then make sure that you're taking vitamins, supplements, and especially important are 2 supplements. There can be more than those, but at least 2 very important are, number 1, you can take diamine oxidase, or DAO. That would help, and I think it is an over-the-counter supplements if FDA did not listen to this and then declared it a drug as well. Diamine oxidase, and secondly, B1. In addition to that, I believe the selenium and then magnesium, vitamin C like products are also necessary, but B1, higher levels of B1 are actually good, plus higher levels of DAO are better. Now, what foods are good? What can we eat? So fresh meat, fresh fish, non-citrus fruits, for example, fresh vegetables, no tomatoes, avocados, no spinach, no eggplant. And of course, if no tomatoes, then for Mubin, no tomato ketchup as well. And then more quercetin. Quercetin, we have done this discussion many times before as well. Red skin products or vegetables and fruits. For example, red apples, berries that are red, or red onions, they all contain quercetin. Less or no dairy, especially the cheeses and those. The more aged cheese is, the more histamine it contains. So you could try alternate, for example, coconut milk or almond milk. My wife tried once to give me coconut milk and I was not very happy. Olive oils or cooking oils are useful. And then seasonal foods. So for example, here in the US, I have forgotten what food is for what season. We get foods and vegetables and fruits at all time. And one of the outcome of that is that sometimes the seasonal foods actually are adjusted to the season and our bodies. And when we take them out of season, they can cause issues. This is now more of a non-allopathic discussion, because in allopathy, we do not believe in these things. But there are seasons, and I know many places where they adhere to seasonal foods very much through the general wisdom of the community. In addition to that, whole foods, meaning less processed foods. And the reason for the less processed food is, and I believe in this one, and that is when you eat something complete and it has some things that would provide an action, it may have some things that would provide the opposite action as well, and balancing action as well. So when you take things in whole, that has all kinds of ingredients that would balance each other out. So this is the discussion for today. I hope this was useful. Do me a favor. So I'm going to come back with the chit chat. So do me a favor, please like, subscribe, and share. I think this should be shared. So like, subscribe, and share. In the description of this video, there is one additional link here if you would like to support this new studio equipment. If you would not like to, there is no pressure. But in general, if you wanted to support this work, I have some links in there to support it. And thank you very much who have already supported. And I'm going to now hang up, and we would come back in 5 minutes and do chit chat.